Let's go back to the doctors' strike now. This is the senior hospital doctors, the consultant strike. We're in the second day of this. I hopefully gave a very impassioned sort of monologue about what I think about the consultants going on strike. These are the top doctors and basically are rendering the NHS pretty useless over the next 2 days. And just in terms of this is the first time the consultants have taken part in strike action since 2012. I think it's worth just telling you that consultants are well paid, whatever they tell you, between 93,000 and 126,000. On top of that, they tend to get paid about 30% more. This is because of the bonus system called Clinical Excellence Awards, and also they work additional hours as well and receive extra payment, and they can do private work as well. Joining me now, Dr. Bob Gill, who is an NHS GP. Good morning to you.
Morning.
I don't know how you stand on this. I'm deeply anxious and concerned about consultants going on strike. I'm not sure it's the right thing to do.
Well, it's the last resort. The consultants have experienced a 25 to 30% real terms wage cut. This is wage theft. We have a government that is busy transferring wealth upwards. The economic case for investing in healthcare, after all, staff are the biggest cost in healthcare. We have a problem of retaining and keeping staff in this country. The UK is at the moment the biggest trainer of doctors for Australia. That's what's happening. We have a brain drain, a hemorrhage of staff and experience out of the NHS. Even before the strikes, the reason that people are struggling in work because of workload is because of the lack of staff. We have big vacancy problem in the NHS. So it's not all about pay. The doctors realise that unless pay is restored to what it should have been before the austerity imposed on the NHS, we will continue to lose staff to other countries.
So I agree with some of that. So we don't train enough doctors, but that was the problem caused by the BMA in the first place. The government says it will train double the number. That is to be welcomed. But just in terms of, and I understand this, that we need to keep doctors in this country. I've been through medical training, but in terms of keeping them and retaining them, money is part of it. But how does that resonate, do you think, with people at home who are struggling to put food on the table when you're on 120,000, 130,000 and you say, I want a 35% pay lift? I mean, the independent pay review body said 6%, 35% is out of kilter.
Yeah, well, the independent pay review body is selected by government. These are government appointees. Don't be fooled by the label independent. If people understood that the wages have been repressed, there has been wage theft from the consultants, where is the money going in the NHS? More and more money is going to service private finance initiative debt and the running of a privatised system. So there's plenty of money there. The government was chucking billions at a failed and expensive pandemic response, 35 billion in the test and trace system. That's all vanished. There's nothing to show for it.
But you see, but hang on a minute. So in terms of the money, we are putting money in, but it's our NHS. We pay for it, and the people held to ransom are patients, and it's not acceptable.
Nobody's saying it's acceptable. It's a last resort. The government is clearly not listening to anything else. Clearly, it's not interested in restoring pay. What else do people do? Do they continue to work in a toxic environment, which is chronically understaffed, not enough beds, a dangerous system, which is hemorrhaging staff? What else do you propose they do to make their feelings understood? There is nothing left. This is a last resort.
Bob, thank you very much for your time. That's Dr. Bob Gill, NHS GP. Time is very tight.